I want to give a shout out to Rick Renard. He posted at the end of last week a recent primary care scorecard published from Millbank. I'll drop the link to that article in the comments. And some of the observations that were coming out of that particular study is that, one, we are continuing to see a decline in participation in primary care. I think we all intrinsically know that, but the data continues to bear that out as a reality. But a couple of things that really jumped out of the report that are concerning. One, we are continuing to see a downward trend of spending across all payers, whether it's government or commercial, in terms of reimbursement for primary care services. In addition, the spread between what a primary care person is, a doctor, provider is reimbursed is roughly 5 times less than a similar specialist operating in more of a procedure heavy segment of care. So for example, an average reimbursement for a primary care provider is approximately $290. For a gastroenterologist, the average reimbursement is just above $1,000. So 5 times more, if you will. Doesn't take a rocket science to see why more people who go into healthcare would continue to skew towards these specialties. Now, the tie-in back to the value-based care discussion we were just having is, out of all of the ACO performances, the ones that did the best, the ones that were at the top in terms of total quality, in terms of shared savings, et cetera, were the physician or primary care-led ACOs. So we know that primary care is the backbone. We know that good primary care delivers great outcomes. And we know from the data that when organizations put together and operate in a value-based care way, that having a strong contingent, if not leadership role by primary care, is a hallmark of success. Then why are we not seeing that particular segment of healthcare providers be more rewarded in terms of how they're financially compensated? I've got lots of thoughts on this. We'll save it for another day. I think there is a radical way that we should think about reinventing primary care.